providing information covering events, activities, and news from Columbus Consolidated Government. You're watching CCG TV News Watch.
Know that as it becomes available, we're likely to see the confirmed case number go up. We don't want you to confuse that with a mass spreading of it. It really doesn't change things in our community or our world, because it still is going to take all of us working together to try to make sure we abide by some of the recommendations, such as covering your mouth when you cough, washing your hands frequently, social distancing, and things of that nature. But we are continuing to monitor the situation very, very closely, and as soon as we get any additional information, we will pass it on to y'all. The key thing is that we want to make sure that we try to avoid is fear. Our biggest challenge is managing some of the information that gets put out. As we've advised you in the past, if you see something on Facebook or you hear something from somebody, please verify it before you put it out and try to start sharing that information. Again, the way that this virus and any virus can be contained is through you. It's through your efforts. The more we abide and we abide those recommendations and we listen to those individuals that are telling us what we need to do to keep it from spreading, the greater the opportunity for us to keep it contained here in Muskogee County. And really, that's it. We would love to see if any of y'all have any questions. We have put some microphones up here so that your stations will be able to capture that.
Mayor, as we've seen, people are really starting to panic already. And as we get into this crisis, are you concerned about public reaction at all?
Yeah, actually, from my perspective, we know we know this is a serious threat. I mean, we only have to look at what's going on in Italy to see that it can turn really deadly. But the facts are that this is a virus that we simply have not dealt with in the past. Therefore, we weren't quite ready from a medical standpoint to deal with it. But the facts are that it can still be contained, and it is very easily contained by social distancing, by following a few simple rules that your mother gave you when you were 5 years old. Wash your hands, cover your mouth when you cough. And the real key is, if you feel bad, don't go into work. Stay home. But we want people to understand that we are on top of this. We are concerned about it, but there's not a high level of fear. We know how to restrict the spread, and we're going to continue at every opportunity to try to share with everybody and remind them how we're going to be successful doing that.
Outside of one confirmed case, that's all the city can release, right? Is the information on that going to have to come from the particular hospital?
That's correct. There are some legal requirements through HIPAA and a couple of other laws that preclude us from sharing any additional information. I can tell you the individual is confined and is receiving treatment.
And that's all. That's the only information we can get on it, right?
That's the only information I can share with you.
Okay. When you were talking about social distancing, Mr. Mayor, it's not easy. People are not, I mean, I noticed as y'all were preparing to go up here, y'all were in a pretty tight cluster. I mean, it's a difficult thing to get into people's heads, correct?
It is, and I think that is an important point to bring up, that all of these simple ways to keep this from spreading are not simple. They have to be very intentional. And if you're not intentional about it, if you don't keep it in the front of your mind to be able to do everything you can to distance yourself from people that you come into contact with, and make sure that you're washing your hands. I mean, it sounds so easy, and how many of us go through the day and go, well, I haven't followed the rule about washing my hands. You have to be intentional. And the good part about that is that in Columbus, Georgia, and in this region, we have a long history of working together and of being very, very united. And the interesting thing I'll mention about this virus is that it reminds me again how we may all be different on the outside, but we're all very, very similar. And it's going to take every one of us working together to try to be conscientious about keeping it safe, not just for ourselves, but also for our loved ones and the people around us.
Now that we do have one confirmed case, is this going to change anything in regards to restaurants and businesses and having them open or not?
You know, I'm not sure the one diagnosis will drive that, but we are going to make some changes in the way we conduct business in Columbus. And We are in the process of putting together something to take to council for Tuesday's council meeting that will address some of those items, to include things where we can make some adjustments and some due dates of city fees that perhaps we can postpone for 30 days or so that those individuals don't have to congregate in one enclosed area. But it'll be something that we'll roll out probably on Tuesday.
Mr. Mayor, obviously first responders are still in the community working. They're often going into situations where they don't know much ahead of time about what they're walking into. Are there additional safety protocols that they're subject to right now?
There are, and I can get Chief Lang up here to talk about it, but basically, there's a couple of things we need to make a point of, and that is that our healthcare workers and healthcare providers and our first responders are the true heroes in this, as they are in any medical emergency. These folks set their safety aside to make sure that they take care of the people that live in this community, and we cannot lift them up and thank them enough for the jobs they do. They do have additional protocol. I know if there's a call and an ambulance is dispatched, they have certain gear that they're required to put on, including shields. They are required to mask the individual if they think they have a respiratory illness. And then they call ahead to the hospital to make sure that they understand they're bringing in somebody with flu-like symptoms so that they can direct them to an entrance that won't take them through the midst of the emergency room.
This is for Dr. Townsend. Dr. Townsend, this, according to a statement put out by St. Francis, this was a person that was in their hospital. In drive-through sites have started. There are 3 open in Columbus right now. Have there been any positive COVID-19 diagnosed out of those drive-through sites that are being operated here?
No.
How many people have been tested at those sites?
We don't have a definitive number because we're still in the process of the testing. It's still ongoing, and one of the sites just started this morning. So we really don't have a definitive numbers, but we do have a limited number of tests that are out there.
So you don't have a ballpark number of how many? So no positive results have come out of those tests?
No positive results as of this minute have come out of those.
How is the drive-through testing going?
It's going well because the people who come through the drive-ins have to already have had a process to go through and be assigned a number by suspicion of their physician. And so therefore, those people are the ones who get priority to be tested because they already meet criteria set forth. And then they are also assessed certain criteria to follow as well once they get there. And even if people show up, they have to follow certain criteria. So not everyone will be able to be tested, only the ones who meet the specific criteria.
Can you share those criteria with us? I know they've changed in recent days.
We're looking at people who have been in company of someone who have been positive for COVID, healthcare workers, the elderly, immunocompromised, so people who may have symptoms, congregate settings.
Say that again.
People who work in congregate settings,
Okay,
hospitals,
okay.
Those are hospital workers or nursing homes or, facilities that may actually increase their exposure to something. And those who travel to areas where there have been positive cases.
And one of those areas right now is Albany. And Mr. Mayor, if you could talk about the situation they've got at Albany right now. They went from 7 to 20 cases with dozens of tests still out right now pending, test results pending. So how do you keep a Columbus from getting in the same situation that Albany is in right now?
Well, I think we've been working on doing just that for the last 2.5, 3 weeks. We've been in constant communication, daily communication with our hospitals. Our capacity is excellent for handling cases, but we understand it's fluid. We're going to check it every single day, and we will have provisions made in advance for the event that we end up filling those beds. And we've kind of gotten in front of it early as far as making sure our folks are educated about the way this virus spreads and how to be careful and take care that they don't unintentionally pass something like that on. I want to say one other thing about the drive-through testing. I actually rode by the site behind the health department today because I wanted to see those folks and see how things were working. Very impressive the way the employees from the Department of Public Health were going about doing the screening, making sure that things were efficient, they were polite, and because a lot of the folks that come to that site and showed up didn't need, according to those criteria, a test. And I also have to lift up our sheriff deputies. We had our folks on site just to make sure that everything was moving smoothly, and it was very impressive. The only thing we need, frankly, are more kits.
Can you elaborate on that?
Very simple. We don't have enough. No, I understand your question. Listen, if we had the test kits to test everybody in Muskogee County, we would do it. We continue to seek opportunities to identify more kits. I know I speak with folks at the health department under Dr. Townsend's supervision, and they're looking everywhere to try to find additional kits. The state of Georgia has a limited number of kits available, so by the time they trickled into Columbus, I would think it's safe to say that if you find us some more kits, we'll be out there, these young folks will be out there trying to get those tests administered.
Dr. Townsend, can you tell me how many kits are in Muskogee County for use and have been since Monday?
I don't know exactly how many. I know how many we received total, and they were less than 50. So I don't know how many operationally that the other sites have received per se, but I can tell you that it's been less than 50.
Does that include the kits that are going from Quest and LabCorp and the private labs?
Yes, that includes everything.
So less than 50 kits have been in Columbus.
See, that was a difficult question to answer in terms of everybody, because we don't know every kit that has been accessed if it did not come through us or if it did not go through the state. And so those numbers really are not available except for what we're doing through our drive-through. The other entities that are operating, we don't have those specific numbers. So that's kind of the best answer that I can give for that question.
And then last question to you, Dr. Townsend, if Columbus, God forbid, was to end up in a situation like Albany is in right now at Phoebe Putney Hospital, does Columbus have the medical equipment necessary, the ventilators, and the stuff that the people inside the hospital need to do their jobs? Do we have enough of that in the Columbus area to handle a situation like what's happening in Albany right now?
I think right now that is a good question for the hospital authorities to answer, the CEOs, because they know what their own equipment is and what they need. They have not been short to date. If they were to get in the same situation that Albany is currently in, they're asking for certain things to be done, like postponing, elective surgeries and having equipment available for PEP, for personal equipment to be available, the ventilators and things like that, only to be used for emergency care. So they're already stretching the capabilities that already exist. Because there's a shortage everywhere of ventilators and things like that take care of the really critically ill patients anyway.
Do you know how many ventilators there are in Muskogee County? Do you have that number?
No, sir, I do not.
Okay, thank you.
I'll tell you that when I posed the question to the hospital administrators just to try to get an idea of their readiness, they are very comfortable that they are able to handle. We did not use a number. We didn't use the same number or even frame it as to another city, but we asked them directly, are we ready if we have a growing number of positive cases in Columbus? And they emphatically said yes. And even though they're ready, they continue to monitor the situation so that as we use up more of those resources, we'll have an opportunity to identify locations to be able to replenish them. Anything else? Well, thank y'all. And the key is, this is not a time to panic. This is a time to come together, do the common sense things that the Department of Public Health and the CDC has suggested we do, and we'll get through this. I guarantee you, we've been through this before with other infectious diseases, and we're going to get through this. It's just going to take a little bit of cooperation on everybody's part. Thank you.